Thank you so much for joining me. Today is just an introduction of a series that I wanted to start to actually focus on the needs of women in terms of their oral health. There's so much information, research for many, many years that has shown that women have an increased risk for dental decay, that women have from bone resorption, osteoporosis, that they have a risk for temporomandibular joint disorders, that women carry stress throughout their lives. And, women's physiology is different. We all know that hormones play a role in everything. Hormones influence our salivary flow, and saliva is a friend in the oral cavity. And without saliva, we are at a risk for gum disease. We're at a risk for dental decay, erosion. And there's so many areas of a woman's health that affect her mouth, that affect her risk for dental disease, gut health, pregnancy, puberty even. Women now are experiencing puberty at earlier ages than 30, 40 years ago. It's unknown what's really causing that, but that's a factor. That surge of blood to the gums is going to put younger women at a higher risk for gum disease. And then what's important on the provider level is to educate our patients and also open up that channel for communication with parents, mothers and fathers, with older siblings to understand the implications for young women to practice good hygiene. Today, I wanted to just, get some feedback from you all as to what areas you would like to focus on. I'd love to have guests pop on this series with me, providers, dental providers, other healthcare providers, of course, women's health providers, caretakers, educators, researchers, and women in the society. We all play a role in aiding each other and informing each other. Now we're just a week out from Thanksgiving. I know everybody is busy with the holidays and preparing for this special family time. And I just wanted to really give some comfort and some words of advice to things to look out for during the holidays. It's an increased time for stress. And so with that, we could talk about, fatigue, for example. One thing for me, I like to work out in the morning and then I see patients all day. I use my body to provide dental care and I am tired. My son's always like, why are you so tired? I think about it and I'm like, okay, I'm getting older. I'm in my 4th decade. And my body's different. I was a competitive swimmer for 10 years during my teen years and early childhood. But I am not the same. I'm not built the same as I was when I was 18 years old. So I have to rest myself. I have to think about my diet and my nutrition. In terms of fatigue, some women may have chronic fatigue. If you are not aware of why you're so tired, you need to talk to your provider. You need to talk to your general practitioner and make sure you get that information. It may not just be that you didn't get a good night's rest. Maybe you need to get more information about what's going on systemically and really get a hold of that. In terms of sleeping, that brings us into salivary flow during sleep and sleep distress. There's a lot of information about obstructive breathing, whether you're snoring or even if you experience sleep apnea, that's very serious. So we need to really think about that. Whether we're grinding our teeth in our sleep or clenching excessively during the day, that's traumatic. That not only has an effect on your TMJ, on this special joint here, but it wears your teeth early. That also brings me into another area that I'm gonna talk about, which is oral beauty. Women, of course, always heavily scrutinized for our appearance, and your confidence is derived from that. These visual mediums are available to everyone, and they're effective, but it does put more pressure on female patients to feel that they wanna look their best. And so if you're grinding your teeth or wearing your natural teeth early, your teeth will appear dull. They will appear old. And it can also change the dimension of your face. Dentistry is very complex. It is restoring teeth, but it's also thinking about the craniofacial relationships, the dimension of your face from your bite, how we support the rest of our face, the harmony that really comes from your smile. And I think that it's really important for us to think about these factors and how they're very sensitive with women. I come from a family of women. I have 3 sisters, cousins. If we do a family picture, it's like Amazon Nation. So I grew up with women I've been treating women for 20 years. So I am more sensitive to my patients who are going through various things, whether they are new grads and experiencing social life and going out and meeting people, or they're growing their families. I had a patient when I was a new dentist who cracked her tooth during childbirth. I mean, I hadn't had my son yet, but I thought, oh my goodness. I mean, I'm aware of how strong the masseter is, but the fact that she cracked her tooth during labor, that reminded me how strong we are and also what we're subjected to, right? And how we allocate that stress. And of course, we could repair her tooth later, but I was thinking, okay, let's think about it. Are you now as a new mom stressed? Was there an underlying bruxism issue? And so all of those implications that come from stress and stress over the holidays, that brings us back to like diet. Everybody wants to, we're not just eating all the creamy gravies. We're also having festivities. We're drinking alcohol. Alcohol dries our mouth. Alcohol leaves us dehydrated. Dehydration not only leads to more plaque collection in the mouth, but it can also lead to chapped lips and thinking about how we moisturize our faces. And that's connected to collagen, that's connected to dermatology. So all of these things are really related. And it also comes back to the fact that oral health and systemic health are connected. Of course they're connected. They're heavily influenced upon each other. Women, as we age, we see risks for cancers. We see risk for heart disease. Osteoporosis is more profound in women. And we have to appreciate those types of changes. Hormonal replacement therapies, what oral implications there are from those type of therapies. There's research on bisphosphonate treatment and osteonecrosis, and understanding that you need to talk to your provider. If you are going through medicated therapies for your health as you age, you need to communicate that with your oral health provider. Research shows that although all of us are trained to recognize symptoms that may be connected to a woman's growth into menopause in her perimenopausal years, many of the providers, almost 57%, have expressed not feeling extremely comfortable asking the patients about their transitioning into menopause. And that is a conversation that I think as providers we need to have. We need to investigate, just like we're trying to figure out how you cracked your tooth. We want to figure out why you have dry mouth at this stage, why we're seeing that pattern of demineralization around your gum line so late in life. You're not a young brusher eating Cheetos and not brushing. You're 55, 60 years old, and what that means. So that gets us back to dry mouth. Over the holidays, if you are partying hard, staying up late, having fun conversations, and you're eating salty foods and drinking rosé, you're going to have a little dry mouth. So it's important to hydrate. What is the rule? For every 2 drinks, 1 glass of water, or maybe it's the opposite. Stay hydrated. Don't brush your teeth right away after you eat and drink. You want to wait a few minutes, but you can refresh with breath mints. You can use chewing gum. You could put a little bit of toothpaste on your tongue. There's some ways to keep things healthy without scrubbing your teeth. The reason we don't want you to brush your teeth after you eat is because it's an acidic environment. And as hard as our teeth are, they are soft after we eat, okay? They're porous. And those pores are open and more susceptible to the acid. And if you go and scrub your tooth at that point, you're going to damage the tooth structure and be more at risk for decay. So just wait a few minutes and then you can brush your teeth. And that really gets me into something that I think all patients need to understand, but especially women. Women may experience nausea, they may experience vomiting, they may experience reflux, and all of these things can be connected to parts of our life. There's some more serious topics like eating disorders. Anorexia and bulimia both have oral health implications. For example, vomiting, regurgitation is going to rinse more acid into the oral cavity. And just like I said, that acid puts you at risk for decay. That acid is not healthy. We want to get rid of that. While we want to treat the underlying problem, we want to be sensitive to those symptoms. When I see a young woman, if I see a 12-year-old, 13-year-old, 15-year-old girl with a heavy amount of decay or erosion at her gum line, I am curious. I am to discuss that with her parent. I am also to discuss things with her. I have to be very sensitive to the dynamics of her life and her lifestyle and things going on. But it really is so important for us to work collectively as providers, as parents, as members of a community to provide this medium for treatment. It's so easy to say, oh, I just want white teeth and I just want to put some veneers on my teeth. But our teeth are actually designed to outlive us. And they're quite strong when they arrive. And with good hygiene, with good home care and access to the dentist, you can actually have a very natural, healthy, beautiful smile. What have we talked about? We talked about fatigue, sleeping, diet, TMJ. And TMJ is like an enigma. We're like, why is it like that? I mean, in dental school, we learned that the temporomandibular joint, it's so special because it not only rotates, it translates. As I tell my young patients, your mandible, you can sit it on the shelf. You know, it's like the skeleton. And it's really special. Every time we open, we're able to close just like that. It's brilliant. It's magical. But as you can imagine, trauma to that joint, pressure from too much clenching, excessive grinding, malocclusion, that could be orthodontic, could be pathological. All of those habits or those mechanisms are going to create trouble on such a special joint. And as you can imagine, as you age, you couple that with resorption, trauma and natural resorption, you're going to develop some big problems. And so we want to look at these things early on. I mean, now we can do things like Botox. If you're going in for Botox for other areas, you could get Botox to relax your bladder from urgencies. You can get Botox to take away, smile lines. And you can get Botox to relax this masseter muscle. Some people may notice that their jaw starts to look more robust and protrude. The bone starts, that buttressing bone later in life. You need to look and wonder, what is happening? Is that something that's natural? Or is that something that's being caused by stress? By me taking the stress out on my jaw? And then, of course, we don't want to just treat the symptom. We want you to then think about holistically, why are you stressed and what you can do to alleviate that stress? Whether it is getting mental health services, discussing things with your family, your church, your community, looking at your load at home. Women are often the primary caregivers. We are the default parents. We know everybody's medical appointments, dental appointments. I mean, I have been treating patients for 20 years, and I'll tell you, the mothers are usually the ones making the appointments for their spouses and the children. And I think that would definitely be parallel in other parts of their lives. The women are planning the vacations, all the hotel stays, the trips for the soccer away games and the swim practice and the hockey tournaments. The women carry stress, and it's remarkable how resilient women are. But there are ways to help us manage that stress. Another area that we could talk about would be your fitness, what you do in terms of taking care of your general health and how you can kind of relieve yourself from that stress. And then, of course, there are oral health implications. Are you clenching when you're benching 100 pounds? If you are, you should wear a mouth guard at the gym. I recommend it. And then also, if you're on some heavy protein diet, you're doing protein drinks and powders and what have you, then that also has oral health implications. You want to make sure you're hydrating, or that you're not compromising your oral health just for your fitness benefits. That leads us into medications. We're going to talk more about particular types of medications that have side effects, oral health side effects. Asthma medication, depression medication can lead to dry mouth, lowering our salivary flow. And of course, without saliva, we're going to have more plaque. We're going to have more risk for dental decay. And we just want to know how to counteract that, not to compromise your health. We want to work in conjunction with that type of therapy for your better mental health. Brushing and talking to your provider. Google's really helpful. I'm actually pleased to see that there's so much more proper information, but still you want to feel comfortable asking questions for your particular situation. And often it's multifactorial. I had a patient this week. She's been my patient for about 3 years. And when I met her, she was missing her front tooth, and she was in her late 50s. And I would tell you, I've been a dentist almost 2 decades. I have had 2 hands of patients, women, who have lost their front tooth. And with inspection and with comfortable conversations, it has been from domestic abuse, which is a very serious topic. And restoring that smile for that patient is very emotional for the patient as well as the dental team. Everything from understanding why the tooth was lost, the time from when it was lost, if it was lost early in life and now you're restoring it 20, 30 years later. There's the changes in the architecture of the bone and the tissue that needs to be taken into account. How the patient wants to look with that restored smile. You're revisiting your youth, you're thinking about beauty, and then of course you're now thinking more about how that tooth was lost. Experiences that women have with regards to their teeth, their front teeth, their smile zone are quite overwhelming. And this patient, the hardest thing about treating her is she does not look at all her age, right? So I look at my chart, I'm looking on my computer, and I go in the room, and I have to remind myself her generation, her age. She's talking about her grandchildren. She's excited and happy about what's going on, but often has a little bit of cynicism and sadness about the past. And I just have to be very sensitive to that. And I remember when we restored her tooth with an implant, and the oral surgeon, another woman provider, was just so sensitive to how she wanted that smile to look. She wanted to have a diastema. So a diastema is a space between the teeth. And she wanted it to look like it did when the tooth was lost, but she also appreciated that, her smile was authentic. And it came out wonderfully. It was beautiful. I saw her for a recall. I just had that nice feeling inside as the provider, like, gosh, this looks so nice. And going into the holiday, it was a great appointment. So we see everything, macroglossia, a big tongue is a reflection of a low functioning thyroid. We may see enlarged parotid glands from eating disorders. We may see shiny gingiva. And we're like, why are they, how the gingiva get so shiny? Not moist gingiva, but shiny. On older women, what is that? And it's phenomenal, but it's biochemical. The oral microbiome of the mouth is spectacular. It's bacteria, viruses, so many things going on at once. Our salivary glands, everything has to be in a certain harmony. And although nature has an effect, the society has an effect. And the external stresses that we feel, particularly as women, can lead to a lot of changes in the mouth. And I just really am happy to have this information and to be able to share it with you. And that's why this series I think it's going to be a really great experience for me as a provider of a certain age. And the conversations about women's health are long overdue, but very timely as well. And we really want to create that open space for communication to flow back and forth. So you guys, please DM me with any particular questions or comments, suggestions. Again, this is a conversation that's open to everyone. We all need to look out for each other from early age and as we continue to thrive. So have a great weekend, and I'll see you guys soon. Bye.